Welcome to Lecto. Today we are going to do comparison between the anemia and the polycythemia. So let's start. First of all, we will see what is anemia. You will see anemia when the concentrations of the hemoglobin decrease in the blood. So this is the situation. When the hemoglobin concentration decrease, then you will see the anemia. If I say technically, when the number of the RBCs decrease, then you will see the anemia. Why? Because as we know that in the RBCs hemoglobin is present. If the RBCs number decrease, then automatically the concentration of the hemoglobin will also be decreased. So it goes towards the anemia. So this is the case of anemia. If we see the polycythemia, it is opposite to the anemia. In the polycythemia, you will see the concentration of the hemoglobin increase. This is for the polycythemia. If I say that when the number of the RBCs increase, then you will see the polycythemia, because when the RBCs number increase, then the hemoglobin that is present in the RBCs will also be increased, and you will goes towards the polycythemia. So this is the case. Now this is the simplest definition between the polycythemia and the anemia. But there are some rare situations in which you will see the polycythemia and the anemia. So here you see there should be balance between the plasma and the number of the RBCs. In normal situation, 55% is the plasma and 44% RBCs having hemoglobin, and 1% remaining platelets and other things are present in the blood. So this balance should be maintained. If this balance disturbed, then condition goes toward the anemia, or you can say polycythemia. So there are two situations which can happen when this balance disturbed between the plasma and the number of the RBCs. So first of all, we will discuss the normal situation. So when the amount of the plasma increase, here is the situation when the amount of the plasma increase and the number of the RBCs normal, then what will happen? So in that situation, when the amount of the plasma increase, then automatically the RBCs number will go towards decreasing slow. In that situation, even though the RBCs number is normal, but the condition goes toward the anemia. Why? Because we increase the plasma, then automatically the number of the RBCs will look like decrease. So in that situation, the condition goes toward the anemia, and in that situation you will see the anemia. This is the anemic condition. This is the case 1. Next is when the amount of the plasma decrease, then what will happen? Even though the number of the RBCs are normal, but you will see plasma decrease, then you will see the condition of the number of the RBCs will increase, and they actually look like increase relative to the plasma. I am saying number of the RBCs increase relative to the plasma. So this is the situation. In that situation, when the RBCs number increase, it actually look like increase, then the condition goes toward the polycythemia, and this is actually the polycythemia. The condition goes toward the polycythemia, and it is actually apparent polycythemia, or you can say pseudo polycythemia. This is actually the pseudo false polycythemia, because in reality number of the RBCs are normal, but the concentration or the amount of the plasma is decreased. So in that situation, the condition goes toward the pseudo polycythemia, or you can say false polycythemia. These are basically the two situations. Okay. When you see the increase in the number of the RBCs, in reality you will see the increase in the number of the RBCs. So in that situation, when the RBCs number increase and plasma actually present in normal amount, so in that situation when the RBCs increase relative to the plasma, so it means the plasma will go toward decrease even though the plasma is normal. So in that situation when the RBCs increase, then the condition goes toward the polycythemia, and it is the absolute polycythemia. Why? In actual or in reality RBCs number has been increased. So this is the absolute polycythemia. Okay. When the number of the RBCs decrease, then what will happen? When the number of the RBCs decrease, so in that situation, if we do comparison with the plasma, even though the plasma is normal, then plasma will actually look like increase. So in that situation, number of RBCs decrease, so condition goes toward the anemia, and it is the real anemia, in which in reality you see the decrease in the number of the RBCs. So this is actually the anemia, and it is actually true anemia. Okay, these are basically the normal situation. Next we will see in case of anemia. In anemia we know that RBC's number is decreased. In anemia RBC number decrease. Okay, now if we see if we do the comparison with the decrease in the RBCs and with the plasma, let's suppose if I say that when the amount of the plasma increase, so in that situation in anemia we know that the RBCs number decrease. Okay, when we increase the plasma, so in that situation when we increase the plasma, so balance will further disturb. So this is the situation. In anemia we see the number of the RBCs is decreased. When we increase the plasma, then the condition goes towards the anemia. So in that situation you will see this is the anemia, and you will see the severe anemia. This is the case. Okay, if we decrease the plasma amount of the plasma, then what will happen? Actually we know that the RBCs are actually decreased in number in the anemia. We are talking about anemic patient. So in that situation when we decrease the amount of the plasma, then what will happen? Here are basically the two similar situations in which you will see RBCs number decrease and we also decrease the plasma, then you will see there should be a balance. So in that situation you will see the balance is maintained when we decrease the amount of the plasma. So in that situation the patient will go towards the normal. So this is the normal, but even though in reality the patient is anemic. So this is the situation. Now if we see, this is the simplest case. As we know that in the anemia the number of the RBCs decrease. So obviously when the RBCs number decrease relative to the plasma, then what will happen? The patient goes toward the anemia. So this is the simplest case. Next we will see the polycythemia. So in the polycythemia we know that the RBCs number increase. Okay, if we do comparison with the plasma, so in that situation we see when we increase the amount of the plasma, so in that situation as we know that the RBCs number increase. Okay, when we also increase the plasma, so in that situation these are basically the two similar situations. When the in polycythemia the RBCs number increase. Okay, when we further increase the plasma, then the balance between the plasma and the RBCs will maintain, and in that situation the patient goes towards the normal situation even though he is facing or she is facing polycythemia. Okay, next is the if we decrease the plasma amount of the plasma, then what will happen? So in that situation, in the polycythemia, RBCs number increase, and in that situation, if we decrease the plasma, then what will happen? The difference between the RBCs and the plasma will large. So in that situation, you will see the severe polycythemia. You will see the severe polycythemia. This is the condition. And if we see the RBCs, as we know that in the polycythemia, we see the increase in the number of the RBCs, or you can say increase in the amount or concentrations of the hemoglobin. So in that situation, you will see the polycythemia. So this is the simplest case. And a special case, here you can see this is a person, okay, when this person faced some accident, and during accident he lost lot of blood. So in that situation, we know that the blood consists of two components. First one is the plasma and second one is the RBCs. So do you think that this person will go toward the anemia because he has lost blood, and in the blood you see the RBCs? No, this person will not go towards the anemia after the accident. Why? Because in that situation, both the plasma and the RBCs has been lost from his body. So in that situation, the balance is maintained. So if the balance is maintained, then you will never see any anemia and the polycythemia. So this is the case. Now, after few days, you will see the plasma of his body will normalize, or you can say that the plasma of his body become recovered. So in that situation, and even though at that time you will never see the production of the RBCs. So this is the case. In this case, plasma amount of the plasma increase, but RBCs number is not normalized. So in that situation, after few days, when the plasma normalize and RBCs are still not recovered or normalized, so in that situation, the condition goes toward the anemia. After the few days, so in that situation, after the few days, you will see the patient goes toward the anemia. So this is the special case. So keep remember, after the but the symptoms that appeared in his body is due to the loss of blood, not the symptoms of the anemia. Because and the anemic symptoms will show in his body after the few days. So this is all about the anemia and the polycythemia. If you have any question, then you may ask in the comment section. Thank you so much.